Dental and vision is so important when it comes to our overall health. It could affect so many things going on in our body if we're not taking care of our teeth and our eyes, such as diabetes, such as heart conditions, and so much more. So in today's video, we're going to show you how to choose the best Medicare dental and vision plans. So if you want to know, stay tuned. So first we have to talk about Medicare to kind of understand your dental and vision options. So we have Medicare, which is Original Medicare. We have Original Medicare Part A, which covers your hospital coverage. And we have Original Medicare Part B, which covers your medical coverage. Now, Original Medicare does not cover dental, vision, and hearing. So it's very important to get a plan that helps with your oral health and your eye health, right? So we're going to go over some of these options in today's video. Now, I do want to point out that Original Medicare will cover things when it comes to your eye if you have a medical condition, like if you need cataracts and things like that. And it will give you a pair of glasses after cataract surgery, but just for regular everyday use of glasses, it does not cover that. And like I said, it does not cover regular dental. So if you choose Original Medicare, Medicare Part A and B, and you go with the Medicare Supplement Plan, since the supplement follows Original Medicare, it pays the 20% that Original Medicare leaves behind. It does not cover these extra benefits such as dental, vision, and hearing. Now, if you choose a Medicare Advantage Plan, then these plans usually include these extra perks such as dental, vision, and hearing. So first we're going to start off with, if you have a Medicare Supplement Plan, how can you cover yourself with dental and with vision? Of course, if you're still working, you could use your employer's dental and vision coverage. If you're not working and you don't have the option to be on your employer's coverage, then we're going to give you some options today. So there are two different types of individual standalone dental plans. So you have your P.P.O plans and you have your D.H.M.O plans. So of course, if you're on a P.P.O plan, then you can see a lot more providers. And if you're on a D.H.M.O plan, then you have to stay within that dental network. So dental insurance is broken into three main categories. So you have your preventative care, you have your basic care, and you have your major care. All right, so let's talk about these three categories. So under preventative, it's going to cover usually at 100% for things like cleanings and exams, because this is preventative. If you're getting your teeth cleaned twice a year, then you could prevent these major issues such as periodontal disease, such as missing teeth and such. Now, when it comes to preventative care, there's usually no waiting period. So you could literally get this insurance plan today and start using it tomorrow for preventative care. Like I said, there's no waiting period. Now let's talk about basic. When it comes to basic, usually the insurance company will cover anywhere between 65 to about 100% of coverage. Now when it comes to basic, this is going to be your x-rays and your fillings if you have a cavity and such. Now basic, usually there is a waiting period. It could be anywhere between no waiting period to about 6 months waiting period where you can actually use that benefit. Now let's talk about major. Major is going to be if you need anything major done. Under major, usually it will cover about 50%, and you usually have to wait a 1 year waiting period. And major is going to be your root canals, your dentures, your periodontal deep cleanings, and such. So if it's major, then it's going to be covered at about 50%. And like I said, you have a 1 year waiting period. Now, when it comes to the waiting period, this can be waived if you had prior dental coverage. So if you just had dental coverage, then you don't have to worry about this waiting period. It's also very important to take note that a lot of these dental plans will have a missing tooth clause, meaning that if your teeth was already missing, it would not replace that tooth. For an example, say you have a missing tooth in the back and you want to get a root canal or an implant, well, that would not be covered because that tooth was already missing prior to you getting dental insurance. Let's talk about the monthly premium on these dental plans. About $25 a month, you're going to get about $1,000 max that you can use for dental. Between $45 to about $50 a month, and you can get a max between $1,500 to $3,000. Now let's talk about vision insurance. Like we said prior, with dental, you can get a vision plan through your employer. If this is not an option and you have a Medicare supplement plan, then you also need a standalone vision plan. Now, usually when it comes to vision, this is how they usually work. They're usually about $10 to $15 per month. Usually if you get the cheaper plan, you can get a pair of glasses every 2 years. And with the more expensive plan, you can get a pair of glasses every 12 months. And they usually have a limit to the amount that you could spend on your glasses, usually between $100 to $150 for frames and your glasses and such. And if you need to upgrade your glasses, there's usually co-pays for like scratch resistant and things like that. So that's usually how it goes for a vision plan. Now with a vision plan, there is no waiting period, meaning you could use the plan right away. You purchase the plan today and you can use it tomorrow. Now let's talk about Medicare Advantage Plans. Now with Medicare Advantage Plans, there are going to be extra perks such as dental, vision, and hearing and such. Now when it comes to the dental benefit, there's usually a max amount that you can spend. It could be anywhere between $1,000 and I have even seen $3,000 or more. Of course, this benefit would depend on the plan, your zip code, and the state you actually live in. So like I said, these plans could have very rich dental benefits. Now there could be two types of plans. One where you have to stay within the doctor network, or you can get a P.P.O as well. You can see doctors outside of the network. And there's also another plan where it's a reimbursement, meaning that you have to pay for this service first, and then you have to file a claim to the insurance company, and then they will pay you after. Now, why would an insurance company do a reimbursement? You may think this is more of a headache, but it's usually because it allows you to go to any dentist, okay? So that is why sometimes these plans is a reimbursement benefit. So make sure you know what your plan is. Is it doctor networks, or can you actually go anywhere and actually do a reimbursement? Now let's talk about the Medicare Advantage Plans when it comes to vision. Usually they will have a vision benefit as well, where you can get an exam and pair of glasses each year. Usually this benefit ranges between $100 to $400 towards a pair of glasses. Now we talked about the different options for dental and vision, and I do want to touch base a little bit on if you have a dual special needs plan. These are individuals that have both Medicare and Medicaid. Now these plans perks tends to be a lot higher when it comes to benefits. So you may see a dental benefit of up to $6,000 and a vision benefit up to $600. So it just depends, like I said, on the plan itself, where you live, the state, and your zip code. Thank you so much for watching this video. I hope I made it really clear for you to understand how you can choose the best Medicare dental and vision plans. If you need any assistance, give our office a call. We'd be more than happy to assist you. Share this video with a friend if you know someone that needs this information. Like this video, comment if you have any questions, and I'll see you on the next video. Thank you so much for watching. Bye.